Hi dear friends, I'm Mayu. Welcome back to our YouTube channel Milestones of Our Life. In today's video I will show you 2 OET Speaking roleplays. One is about Warfarin Injection for a stroke suspected patient, and the next is about persuading an angry patient to wait for a doctor review in A&E. Dear friends, thanks a lot for all your support and encouragement. If you are watching our video for the first time, please don't forget to subscribe to our YouTube channel, Milestones of Our Life. Please share our videos to your loved ones. We've already uploaded many videos related to OET, IELTS, NMC process and so on. If you couldn't find them, just search in YouTube as Milestones of Our Life YouTube channel and click in all videos. Please don't forget to enable bell icon to receive notification as soon as we upload new videos. Roleplay 5. Candidate cue card. Setting, hospital ward. Nurse, you are speaking to a 48-year-old woman, Patricia Caline, who has been admitted to the hospital with a suspected stroke. You have been asked by the doctor to administer a Warfarin injection, anticoagulant, to the patient. Your task is to take the medical history of the patient before giving the injection. Explain that after the injection, Warfarin needs to be taken in tablet form every day for the next 4 weeks. Explain that you need to check if she can continue her herbal supplement as it may interfere with Warfarin or cause side effects. Emphasize the importance of cautionary measures regarding Warfarin. Minimize vitamin K in diet. Avoid medicines due to their interaction with Warfarin. Take a dose at the same time each day. Offer to provide a detailed patient information leaflet on Warfarin. Educate the patient about possible side effects of Warfarin like nosebleed, bruising, blood in urine occasionally etc. Advise the patient to contact the doctor immediately in case of unusual or prolonged bleeding.
Interlocutor cue card. Setting, hospital ward. Patient, your name is Patricia Caline. You are a 48-year-old woman who has been admitted to the hospital with a suspected stroke. You do not have any significant medical history except polycystic ovary syndrome for which you take herbal supplements. You do not drink alcohol and have never smoked. You are speaking to a nurse who has come to give you a Warfarin injection. Your father also takes Warfarin tablets, which causes his nose to bleed occasionally. Task: respond to the nurse's questions. Be reluctant to the idea of giving up your herbal supplements. Ask the nurse for necessary information on things to avoid while taking this medication. Request more information about foods to avoid as you are uncertain about which foods have vitamin K. Explain that you are concerned about possible side effects and ask if you can stop the medication in case of nosebleeds.
Hello Pat, my name's Matt, and I'm one of the registered nurses on duty today.
Hi Matt, are you alright?
Yes, I'm fine. I am here to give you your medication. Is that okay?
Yes, of course.
Thank you. Your doctor has prescribed Warfarin. It's an anticoagulant medication used for thinning the blood.
Yes, I think they are the tablets that my father takes for his heart condition.
Yes, Warfarin is usually taken in tablet form, but in your case, the doctor has advised an injection to get it working more quickly.
Oh, all right.
Before I can give you the injection, I need to ask you a few questions. Is that okay?
Yes, of course. Go ahead.
Do you have any ongoing medical conditions like hypertension or diabetes?
Yes, I have polycystic ovary syndrome.
Okay, do you take any medication for that?
Yes, I take a herbal supplement which helps to calm down its symptoms.
Okay, are you on any other medication at the moment?
No, I am not taking anything else.
Are you allergic to any medication?
Not as far as I know.
Okay, do you drink alcohol?
No.
All right. And would you mind telling me if you smoke?
No, I have never smoked in my life.
So, you are not on any medication apart from the herbal supplement for polycystic ovary syndrome at the moment? You are not allergic to anything and you do not smoke or drink alcohol. Is that correct?
Yes, that's right.
All right, now I'll give you the Warfarin injection, and following that you need to start taking it in tablet form every day for the next 4 weeks.
Okay, for a whole month, did you say?
Yes, that's correct. Also, I need to check with the doctor whether you can continue taking your herbal supplement.
What? Why? It really helps me in calming down the symptoms. I do not think it's dangerous in any way.
Well, Warfarin can cause problems if it's taken with some herbal supplements. Therefore, I need to check with the doctor, and you can take it if he approves.
What kind of problems?
Some supplements interfere with the medication's efficacy or may cause side effects. So it's imperative that we take the doctor's consent in this matter.
Oh, all right. Well, I think I will avoid it at the moment, just to be on the safe side. Is there anything else that might interfere with this medicine and needs to be avoided?
Yes, there are some more things you need to be aware of. Firstly, you need to take your medication at the same time each day. Do you think you will be able to do that?
Yes, it's not a problem. I will manage.
Good. Secondly, do not take any over-the-counter medication without checking with the doctor first. Like I mentioned earlier, there may be potential implications of adding new drugs to this medication.
Sure, I understand.
Finally, you will need to minimize your intake of foods rich in vitamin K, as they can make the Warfarin less efficient. Have you understood so far?
Yes. But I am not sure I know which foods are rich in vitamin K. I mean, how do I know what to avoid?
Yes, I can understand your concern. I can give you a patient information leaflet with detailed information about managing your diet while you are on Warfarin.
All right. That sounds great.
Do you have any questions about what we just discussed?
Yes, I am worried about its side effects. Occasionally these tablets give my dad nosebleeds.
Right, nosebleeds can be a side effect of Warfarin. At times, people pass blood in the urine or get bruises. But these happen only occasionally. Warfarin is generally well tolerated by patients. It is not something to be concerned about. However, in case the bleeding is excessive or prolonged, you must contact the doctor immediately.
Oh, so you mean that it can cause a hemorrhage?
I can understand that it's frightening, but it's very rare. Still, you need to seek immediate medical advice in case the bleeding is unusual. Warfarin is not dangerous if you adhere to the instructions outlined in the patient information leaflet. And in case you notice a symptom that you feel is a cause for concern, seek medical attention immediately.
Okay, in case I notice heavy bleeding, I should stop the medication, right?
Yes, in the case of severe bleeding, the doctor might regulate the dose, so it will be best to check with the doctor before resuming the medication in that case.
Okay.
Is there anything else that you would like to ask?
No, I think I will read the leaflet and let you know if I have any questions.
Yes, that's a good idea. I hope I could address all your concerns.
Yes, the conversation was really helpful.
Thank you. I will just get the patient information leaflet for you, and you can press the buzzer in case you need anything else.
Okay, thanks.
Roleplay 6. Candidate Cue Card. Setting, Accident and Emergency. Nurse, you are speaking to Miss Keely Bradshaw, a 31-year-old woman, who is complaining of a severe throbbing headache on the right side of the forehead. She is distressed as the severe pain is preventing her from participating in work and wants medication for immediate relief, for getting back to work for a major business meeting. Your task is to take a relevant history of the patient's condition including onset, triggers, severity, etc. Inquire about the patient's nature of work. Explain your preliminary diagnosis of a migraine which is probably triggered by stress. Persuade her to wait for 30 minutes to see one of the doctors. Reassure her and explain why it is best to wait and see a doctor.
Interlocutor cue card. Setting, accident and emergency. Patient, you are Keeley Bradshaw, a 31-year-old woman. You have an excruciating headache on the right side of your forehead and above the ear. You work as the marketing director of a large business and want to get back to work quickly for a meeting. You'll have to come to the A&E to get medication by a doctor or a nurse. You don't really care. The headaches started 3 weeks ago, 2 attacks in a week, and are accompanied by nausea and dizziness, and the pain is so sharp and painful, 10/10, that you cannot get any work done. The sunlight from your office window and staring at your computer screen makes the headaches much worse and sometimes even causes ringing in her ears. At times, you start to see bright spots on the computer before onset. It is relieved by Tylenol or sleeping for 1 or 2 hours. You'll have to work long and stressful hours at your desk every day. You have been increasingly stressed at work recently because you are behind schedule with multiple upcoming project deadlines. Task: explain your concern about wanting to leave soon for a meeting. Respond to the nurse's questions about your symptoms and work. Be difficult to convince when the nurse is explaining about the possibility of a migraine and need to see a doctor. Eventually, you agree to wait for another 30 minutes to see a doctor.
Hello, I'm Matt, and I'm one of the registered nurses here. How can I call you?
Oh, you can call me Kale.
Can you please tell me a bit about what happened?
I have an excruciating headache on the right side of my head. It feels like someone has gripped the right side of my neck.
Okay, I can understand.
Actually, I am running a bit late for work and just want a tablet or injection for pain relief.
I hope you don't mind if I ask you a few questions regarding your headaches. May I do that?
Yes, of course. You can ask me.
So, is the pain on just one side of the head?
That's right. On the right side of the forehead and above the right ear.
And how severe is the pain? On a scale of 1 to 10, how would you rate your pain, with 1 being the lowest and 10 is the worst pain you have ever experienced?
I would rate it at a 10. It's really hurting.
That's a pity. That must be really difficult to cope with. Could you tell me if it is a throbbing pain or a dull or sharp ache?
Well, I would describe it as throbbing.
Okay, is this the first time, or you have had them before?
No, this is the 3rd week. They come at varied times, almost twice a week.
So, what you are saying is that you started getting these headaches about 3 weeks ago and you have had at least 2 episodic attacks every week. Is that right?
Yes, absolutely.
And during these episodes, how long did the pain last?
It lasts between 15 minutes to 2 hours, is quite persistent, and the pain becomes worse over time.
Okay, is the pain accompanied by any nausea, vomiting, or dizziness?
Well. It usually makes me nauseous and dizzy, but only until the time the headache lasts.
All right. Is there anything that alleviates your pain?
Yes, the pain subsides with Tylenol or sleeping for 1-2 hours.
Okay, could you tell me if anything exacerbates your pain?
Yes, I have noticed that sunlight from my office window and looking at the computer screen makes the pain much worse. In fact, sometimes it causes ringing in my ears as well. Oh, there's another thing. Just before the headaches, I sometimes see bright spots on the computer screen.
Okay, could you please tell me about what kind of work you do?
I am the marketing director of my company.
Okay, and how many hours do you work?
That depends. Normally I have a 40-50-hour work week, but I have been running behind on some project deadlines lately, and so I have had to increase my working hours.
Oh, it will be really stressful.
Exactly. In fact, I have not been able to concentrate at work. The headaches are making me lag behind at work.
All right. Based on our chat, your symptoms are suggestive migraine. You can see a doctor here in about 30 minutes who will be able to confirm the diagnosis and prescribe some medication.
What? What do you mean? I just want some medication so that I can get back to work. I have some important commitments today, and all I want from you is some medication to make these headaches go away. I certainly do not have any time to wait.
I can understand your situation, Kale. But your health is our utmost priority. If you do not seek the right treatment at this stage, you may continue to experience severe pain in the future, which will interfere with your work. Therefore, it is imperative that you consult a doctor today itself so that he can prescribe the right medication and suggest if any lifestyle modification is needed.
Oh Lord. I do not know what to say. And what do you mean lifestyle modification?
I know this is a lot to take in. Since you have a stressful job, it is a possibility that stress is triggering the headaches. Another thing is that migraine is easily manageable with the right medication and lifestyle adjustments which will be determined by the doctor.
But what about my meeting? It is crucial.
I completely understand that it must be challenging for you, considering the stage you are in. It must be overwhelming. It's quite normal to feel this way, but I strongly recommend you to see the doctor to prevent future episodes which may be worse than what you have been experiencing.
Well, I suppose I can wait another half hour and get my meeting postponed.
I am glad to hear that. The doctor will see you in about 30 minutes. I will also give you a patient information leaflet about a migraine which will explain some of the things I have been talking about. If you have any questions after you read it, just let me know. Is that all right?
Yeah, sure. Thank you.
Here comes the end of our second role play. Dear friends, hope you all enjoyed the video. Once again, thanks a lot for all your support and encouragement. Please don't forget to subscribe to our YouTube channel, Milestones of Our Life. Hope you'll share our videos to all your loved ones. Bye for now, and see you in the next video.